Imagine a surgeon operating on a patient thousands of miles away, guided not by direct vision, but by a three-dimensional reconstruction of the patient's organs projected into a virtual environment. This is not science fiction. It is the emerging reality of virtual surgery, a field that fuses virtual reality, VR, robotics, and artificial intelligence into a new medical profession, the virtual surgeon. What a virtual surgeon does. Virtual surgeons rely on high-fidelity 3D models created from CT and MRI scans to guide robotic tools or to train themselves and their peers. In operating rooms at institutions like Johns Hopkins, augmented reality headsets already overlay brain scans directly onto a patient's body, functioning like a GPS for the human anatomy. Surgeons no longer need to glance away at a monitor. The map of the patient is projected directly into their field of vision. Training is another frontier. VR allows medical students and residents to practice complex operations on virtual organs rather than cadavers. These simulations are so detailed that they can replicate rare pathologies and unpredictable surgical complications, giving doctors a rehearsal stage for high-stakes moments they may face only once in their careers. The role of the virtual surgeon demands a hybrid skill set. Beyond mastery of anatomy and surgical technique, practitioners must navigate advanced imaging technologies, program and calibrate VR platforms, and manipulate robotic systems with precision. They must also combine analytical thinking, real-time decision-making, and communication skills to coordinate with remote teams. In effect, a virtual surgeon is part physician, part technologist, and part systems operator. Where virtual surgery matters most? Three areas are already seeing transformative impact. Neurosurgery, VR, improves visualization of delicate brain structures and helps surgeons plan tumor removals and deep brain stimulation with pinpoint accuracy. Orthopedics, surgeons use VR to model bone alignment, optimize implant placement, and reduce postoperative complications. Minimally invasive surgery, VR navigation reduces the need for large incisions, speeding recovery times and lowering patient risk. Beyond individual procedures, VR platforms are creating opportunities for global collaboration. Experts can conduct masterclasses, supervise operations remotely, or consult on complex cases in real time. The profession of the virtual surgeon is poised to expand rapidly as AI enters the operating room. Intelligent systems are beginning to analyze massive datasets of patient outcomes, offering surgeons predictive insights into the best treatment paths. In the future, a virtual surgeon may rely on an AI co-pilot that flags potential risks or recommends surgical strategies on the fly. Startups like Surgical Theater are already demonstrating this future. At Stanford Medical Center, neurosurgeons train on detailed VR reconstructions of patients' brains before stepping into the operating room. It's literally a window into the brain of the patient we're about to operate on, says Anand Veeravagu, who leads the program. The trajectory is clear. In the next decade, we may see remote surgeries at scale, enabling world-class specialists to treat patients in underserved regions. Hyper-realistic VR simulations, merging tactile feedback with visual fidelity so that training feels indistinguishable from reality. Surgical metaverses, where global teams collaborate in shared 3D operating theaters. Integration with robotics, allowing one surgeon to oversee multiple simultaneous procedures across the globe. What began in the late 1980s as experimental simulators has become a defining frontier of 21st century medicine. Systems like the Da Vinci robot in 2005 and Microsoft's HoloLens in 2016 paved the way. Today, the momentum is unstoppable. The future of surgery will not be limited to the physical presence of a doctor in an operating room. Instead, it will be shaped by those who can operate at the intersection of biology, data, and virtual space. The virtual surgeon is not just a new profession, it is the blueprint for the next era of medicine.